Hello and welcome to Yodo. I'm Dr. Sarah Bohn. Today the subject matter is going to be about me and a personal encounter I've had with the recent healthcare system, the healthcare industry itself. I just want to point out that physicians are humans too. We have jobs, financial stressors, personal issues, families, and healthcare issues that affect us as well. I was on vacation and I had a healthcare issue arise. It always renews my appreciation for patients and the struggles that they go through with their loved ones or themselves when they're trying to access the healthcare system after I've had an encounter with the healthcare system. You might be trying to help yourself, a neighbor, a relative, a close friend, but somebody who needs to access that system. How does anybody access this healthcare system that we have? And that's kind of a rhetorical question. I don't know that there's actually a perfect or a right answer for that. My personal story is I began noticing flashing lights in one eye off to the side, kind of like maybe a lightning bolt or maybe a camera flash. I would just catch a glimpse of a bright light off to the side in one eye. And then within a few hours of that, a large floater, like a thick wad of black thread or a squashed bug, kind of appeared right in my central vision. But I didn't have visual loss. I could see around or kind of through that floater. And the flashing light sensation kind of eased off and went away within a few hours. There was no shroud that came down. There was no curtain, no veil. You know, I think anybody who's been to the eye doctor has been asked about those questions about the flashing lights or did a veil come down or anything like that. And as I said, my vision seemed to basically be about the same, but for that large floater kind of right in the center part of my vision. Now the peripheral vision didn't seem quite right, and I couldn't tell if there was like a grid over there or there were several tiny floaters over there, because when you look there, of course that moves to the side. So I couldn't really track it and figure out what that was off on that same side where I'd seen those flashes of light. But over time, those flashes of light did disappear. I think what I was capturing in my vision was just tiny floaters. So that's the change. Now for a little bit of history, I've had vision trouble since I was really young. And like many people, I don't really actually recall a time when I wasn't wearing glasses. From the time memory first serves me, I think I was wearing glasses. And I do know that I wore hard contact lenses pretty much in middle school, maybe even in late elementary school. And now thinking back on that, that seems like it's a really young age for somebody to be putting a hard piece of glass in on the surface of their eyeball. My vision issue has pretty much just always been nearsightedness, myopia. Over the years, that term myopia was used a lot about my vision issues. And so a lot of people, as they age, they need to be pushing things further and further out. As I age, I kept having to pull things closer and closer in. And like most everybody else with a vision problem, over time, it just seems like it gets worse. With that progression, you have the daily frustration of glasses or contacts or glasses getting dirty, or you take your glasses off to take a shower and then you can't remember where you put your glasses. So you just kind of get into a routine and you just adapt to those issues with glasses. And I'm envious of anyone that has great vision. You're always on the search for an eye doctor that's knowledgeable and compassionate about your vision problems. And, it's certainly not so severe that it keeps me from driving, although I do tease myself about driving by the Braille method. I see with corrected vision like everybody else does. So now back to this new vision change and the issue that occurred while I was on vacation. It was just one eye and no other symptoms. No headache, no eye injury, no redness, no tearing, no vision distortion really, or wavy lines. And again, the floater was just the one big one kind of in the central vision, but not really a visual loss. So I didn't have a veil come down. I still had vision in that left eye. No weakness peripherally, no central symptoms, no pain, no paralysis, no numbness or tingling. I was walking fine, talking fine, eating and drinking fine. So it was just that flashing of light and then the appearance of the new floater. Still, having been asked about 50 times in the last 50 years if I've experienced flashes of light, I know that's an important symptom and it's something that shouldn't be ignored and something that shouldn't be put off. I would be returning home the next day, and so I would plan on getting evaluated that next day. that would be the appropriate thing to do. Being a pragmatist, that kind of can interfere with my actions sometimes because I want to extrapolate a problem and I don't want to bother anybody else. And I think a lot of patients are similar in their thinking of we don't want to trouble somebody if it's not worth being, if this isn't something that we should be troubling others about. One, I'm on a cruise ship and I'm just on the east coast of the United States. So I'm going to be getting off tomorrow. I don't really know that I need to do something about it right now on the ship, and I'm thinking there's probably not an ophthalmologist on the ship. Two, I'm not going to be flying, and it's less than a 3-hour drive to get home from when we get off of the ship. So I'm thinking that tomorrow will be an appropriate day for me to go in and get my vision evaluated. The third thing I'm thinking about is these symptoms that I'm having. Sure, I had the flashes of light, but now the only remaining symptom I've got is just that floater. My vision otherwise is still the same. Our ship arrived on time, and I was in the car by 9 o'clock making a call to my optometrist. I don't have an ophthalmologist because other than needing glasses, I don't really have a vision problem, so I just go to an optometrist. And there's a big difference between an ophthalmologist and an optometrist. So I had hoped that the optometrist would get on the phone, but I wasn't really surprised when he didn't. I wasn't really surprised when he wasn't the one who responded to my questions, and it was just a staff member who took my history information, went to him, came back to the phone, asked me more history information, then went to him, and then finally ended up just telling me, I'll call you back in a few minutes with some more information. So it was the front office staff who did all the interaction. And I can't say I wasn't really surprised about that, but I had hoped I would get to talk to the optometrist. I was not surprised that the optometrist didn't call to make an appointment with a specialist, but I had kind of hoped that he would have instructed his staff to do that, which they did not. So the first number they gave me to call was an 800 number that was disconnected. The second number that they gave me to call was having some sort of other phone issue, and I was concerned that whatever ophthalmologist office this is, they're just not open today because it rolls immediately to this voice message. So then when I called back to the optometrist, now I've talked to just about everybody in their office except the optometrist. I called back another time and was just given the instruction to just go to the emergency department. Being told to go to an emergency department for shortness of breath, a broken arm, a laceration, chest pain, a suspected stroke makes total sense to me. And I would never question anybody who took a child into an emergency department because kids don't come with an instruction book. But I honestly struggled with the concept that a visual floater constituted the need for me to go to an emergency department. As a physician, we are constantly bombarded with a few facts. Antibiotics are overly used and inappropriately taken by patients. There's an epidemic of deaths related to street and prescription opioids and pain medications in the United States. And patients lack insurance, they lack the ability to appropriately access the healthcare system, and the emergency department is overused in almost every hospital nationwide. They go for the wrong reason. So I fall into this last category. Am I going for an appropriate reason to an emergency department? I did call the 800 number on my insurance card, which the first number I called, of course, is not working because it's on a Saturday. And the next number I called was to the nurse helpline, and I did get through the phone tree and was able to get to the nurse, and she wasn't able to give me advice over the phone and even told me so, and also advised me to go to the emergency department. So my family member who's driving the car remained calm this entire time and remained supportive, verbally encouraging me to go ahead and go to the emergency department. So my whole phone experience, even though I've got a piece of paper with me and I'm writing all these numbers down and writing names down and then drawing a line through it because it's a dead end, they're supporting me through this whole journey. I hardly go anywhere, it seems like, without a piece of paper and a pen ready to access and write down some information and some notes. So I literally filled the page with names and phone numbers of who I called and the information that they told me and what I was supposed to go or what I was supposed to do next, and then would draw a line through that on to the next one. Now I know that to have an evaluation, as I kind of feared in the back of my mind since this whole event started, like many people, it's hard for me to find the help that I need in a timely manner. And I see all too often in a teaching institution where Patients come in and they have symptoms that have been present for a long period of time. Students and residents are always asking me the rhetorical question, why did the patient wait so long? And I know why, and you know why. We can't access the system easily and directly. I reached out to my friend that you know from the channel, Dr. Tartaglia, and I told her my plight. And of course, she also echoed the same thing, that I have to go in, you have to go in, you have to get checked, and you have to do it today. I shared with her my symptoms and my concerns, and she, confirmed what my family member and I thought. I don't have an alternative other than to go to the emergency department. Now we're back to that whole scenario of situations that make an emergency department visit very reasonable. And in each one of those instances, you should go to the closest emergency department available. The patient is going to be stabilized at an emergency department, and the needed specialist will evaluate them. If that needed specialist is not available at that hospital, as soon as the patient is stabilized to a point where they can be transferred, that patient will be transferred to a different hospital, because not every hospital has every specialist on staff. The patient will be transferred to where the specialist is. For me, the pragmatist, I'm stable. I don't have any uncontrolled symptoms. My vision other than the floater is unchanged, and the flashing lights have gone away. So I'm thinking, I don't want to go to the wrong emergency department, and then they're going to do a bunch of tests on me, waste a bunch of time on me, and then they're going to tell me we don't have an ophthalmologist and you're going to have to transfer to another hospital. So I wanted to reasonably go to the most reasonable hospital first to try to cut down on everybody's time involvement. So several hours into the changes of my vision, and my question remains the same. Is this a normal change? Could it be something threatening my vision that's permanent, like maybe a retinal detachment? And where do I find somebody that has the expertise and the willingness to evaluate me? We finally decided to go to a large hospital system in our home area, and I chose a level 1 trauma center because most level 1 trauma centers have nearly every imaginable specialist represented. And again, if you're having a true emergency like the ones I delineated earlier, where there's chest pain, symptoms of stroke, a fracture, a laceration, shortness of breath, you need to just go to the closest emergency department so that they can stabilize the individual and then transfer if transfer is needed and appropriate. But I didn't necessarily need evaluation because my symptoms are so severe, but I do want to get evaluated the same day. After 90 minutes of calls and reaching no clear delineation of where I should go, it seemed like that was the appropriate thing for me to do, was to go to a higher end tertiary care center that would have everybody available to see me if needed. It would be completely foolish for me to just ignore the symptoms, and I would encourage anybody that's having acute symptoms to get evaluated and don't feel judged by the system or the people that are caring for you. At arrival of the emergency department, within a short period of time, they all seamlessly accepted my history and placed me into a room. I walked up, glass window, they took my information, they unlocked the door and allowed me entrance into the outer area of their lair. Of the 3 different intake personnel, when no one introduced themselves to me as a nurse, they did give me their names, but they didn't ever tell me their credentials. They took my identification, they accepted my insurance card, they obtained my vitals, they took a visual acuity test and made sure I knew how to read the alphabet. And then each one of those individuals asked me identical questions about my symptoms. I was then escorted into the den that would become my home for the next few hours. Along the way, I passed by the nurses and physicians station, which is like the very nerve center of the higher thinking and action area of that inner area of the lair. And I was paraded past multiple small rooms with sliding glass doors that are partially open and a curtain that's partially shielding the patients inside of those rooms. Only a few of those people had family members with them. My family member waited in the car. I was much younger and yet significantly older than most of the other patients that were in the emergency department that day. I was placed in the room and then abandoned for just a few minutes. A nurse, as to say a registered nurse, or an RN to be precise, arrived to the room, verified my name, my complaint, and then promptly disappeared just as rapidly as she appeared. She did not retake my vitals, but she did retake the full history. A few more moments passed, and a limping elderly male appeared and introduced himself as the physician's assistant, the PA, that worked in the emergency department. He noted me looking at my phone and commented, "Here for a vision problem, but I can see that you're able to read, so at least you can see." He then asked me, I think this was now the 5th person that took my history, the same identical questions that everybody else had asked me. And I completely understand this, as each provider wants the history for themselves. As a physician, I can tell you that reading the chart is oh so helpful, but little nuances in the telling of the story a second time by a bystander, the author of that note, can alter unwittingly and change the meaning and the significance of some of that information. I honestly do not mind being asked again and again to tell my story, and I beg you, please don't get upset when you're asked multiple times to tell everybody that comes into your room to please tell them that same story, because they all want to hear it from you. As he disappeared, another lady pushing a computer on wheels arrived, and she asked me how I wanted to pay. No comments there. The PA then came back to my room, and he held out his arms in front of me and kind of wiggled his fingers in an attempt for a visual field test. I did participate with a brief cranial nerve test, and I also passed that without difficulty. He then disappeared, and I did not see the PA again. A few more moments passed, and a physician appeared with the RN that I had met previously. He also repeated obtaining the history for himself, and for the first time in this encounter, I revealed my occupation. If any at all, his demeanor only changed slightly. He did a few additional neurologic function tests that you can do bedside to rule out that I was having a stroke. And when I discussed that I had no systemic symptoms whatsoever, he accepted that information, and he really didn't press me to try to, gather more information, but he accepted it at face value. He reviewed my medical history. He reviewed my medications. It was a very appropriate encounter. They both exited the room, and another attendant came in, and they wanted an EKG. I allowed it. They wanted a CAT scan of my head, and not wanting to be labeled as a difficult patient, I allowed that as well. I was always afraid somebody's going to do a CAT scan of my head, though, and they're not going to see anything. So that did cross my mind. They wanted a blood test, and they wanted to start an IV. And I told them it's not that I refuse those things, but I want to wait and see what has to be done. One of the comments that the physician had made was he wasn't sure if I would be able to stay at this hospital, or I might need to be transferred to another center because of no ophthalmologist in the hospital on that Saturday. I just wanted to wait and see. Are they going to keep me here, or are they going to send me to another place, even after I did all of that investigation and spent all that time on the phone? The physician returned shortly and checked the pressure in my eye with a little device, but he only checked the pressure in that eye, and then he promptly retreated from the room. So I've been in the emergency department for just about an hour and a half when the emergency physician returned to tell me with a big smile that an ophthalmologist on staff had been called and he was going to come in to see me. His smile broadened when he announced that the specialist would be there within an hour, maybe 90 more minutes. So I was pretty excited, and he was definitely excited. The RN then reappeared shortly, and she put some drops into my eyes to dilate them, and she peeked in on me about every 15-20 minutes in the following hour to make sure that I was okay, and every time she'd come in, she'd make me promise that if I needed her to get up or for something, that I'd press the button, because she wanted me to make sure I used the call light. Already having a little bit of a vision change and then having my eyes dilated, she doesn't want me to get up and try to walk around and fall. Then the specialist arrived. And what I could make out of his figure, because now my eyes are fully dilated, he seemed young, maybe in his mid-30s. He dug a few tools out of his backpack, and he apologized for punishing me with his bright light that he shone in the back of both of my eyes to evaluate them. And he evaluated the good eye first, and then the bad eye, and he evaluated the good portion of the bad eye first, and then the last thing he looked at was the center part of my eye, and then that kind of left side where my complaint was. He made a pretty rapid assessment. He only performed that dilated eye assessment, and he announced with happiness that he could see that large floater, that I did not have a retinal tear or detachment, and he gave me the diagnosis of a vitreous detachment. And he said likely it's related to my age and the severe myopia that I had. He quickly learned a little bit about me and my occupation and my backstory. He announced to me that he'd recently moved to this area of Florida, and he also was from the Kansas City area. He told me that he wanted me to see one of his partners, as he's actually a pediatric ophthalmologist. He warned me that if the office staff gave me difficulty about seeing his partner, that I could go ahead and schedule a follow-up emergency department visit with him, but he felt that would not be good utilization of his time or mine, as well as not being money well spent. But he said, if you can't get through and get into my partner, he said, schedule an appointment with me and I'll make sure that you get in to see my partner. Then that was it. And he was gone as fast as he appeared. I'm home now, and I still need glasses just as much as I did before, but I'm not really any worse for the wear. The eye dilating drops lasted well into the next day, and that's one of the things I really don't like about being dilated. When I go to the optometrist, I have to take somebody with me to drive me home. They always say, just wear dark glasses. No, you don't understand. I don't see very well at all, and I don't feel safe to drive after I've been dilated. I think knowing your limitations is important. I still have the floater, and it's not yet started to settle. He said over time it will settle and it will shrink, and so I'm hoping that it gets out of my central vision. So I'm just doing the best I can to ignore it right now. Did I learn a lesson in all this? I don't think so. It verified to me that the healthcare system is not set up for efficiency, and it's not really all that helpful to patients, families, and it's not really friendly to the people who even work inside of the industry. The nurse confided in me as she escorted me out of the emergency department to go to the car where my family member was waiting, that she too has seen many changes over the last 20 years of working in the emergency department. She had no words of wisdom or advice from her vantage point of working in the emergency department that I could pass on to you either. She echoed her concerns for the future of healthcare for the American public, that instead of changes and improvements of the system being highlighted during this COVID pandemic that we went through in 2020 and 2021, that the situation has frustratingly become more of the same, and in some cases even worse. Advice from my experience is don't ignore a health issue. Live each day to its fullest, take care of yourself the best that you possibly can. I'm so reassured and happy that my family supported me, and I had a good friend that I could call and would advise me and also echo that I needed to go in and get checked. I was encouraged to seek help at every crossroad, and I never felt from anybody that I shouldn't endeavor to pursue more care. The optometrist's office encouraged me to go in. True, they did not help me. When I contacted the emergency department, they welcomed me in, and I didn't feel like I was judged or ridiculed by anyone that you came in for that problem. So I did feel justified in going to the emergency department, and I did feel like I should be there. Don't take it personal that the system is the way that it is. Get insurance that you can afford that hopefully fits you and fits your needs. Call and ask questions, learn whatever you can, advocate for yourself or others, listen to your physician, provide them the best information and the most accurate history you can, and be prepared to repeat it often, and don't be offended that somebody else is going to ask you the same question again. Bear in mind that physicians are humans too. They have their own needs and their own healthcare issues. If you've got a good physician, please let them know that you appreciate them and what they and their office staff do to try to help you and your family. Thanks for watching. I do appreciate your time. Bye now.